We were treating a disease that we had never seen before. The closest analogy is the initial AIDS epidemic in the 1980s.
We had to make a lot of changes very quickly.
Our intensive care unit is 16 beds, and we had to go up to, I believe, 83 beds.
You couldn't do surgery anymore, so all of a sudden now those rooms were made into ICUs.
We weren't completely clear what the prognosis was for everybody. We weren't sure why some individuals were affected and others not, and how it was transmitted.
We made sure that, before patients got on the ventilator, we made sure that we FaceTimed with the family to have that last conversation, because we didn't know what was going to happen.
I was getting a little short of breath. You don't think COVID, you think, oh, I'll see it through. It's gonna pass. But it did not pass.
I said to him, we need to decide what's going to be our game plan. What hospital are we going to go to? If this gets bad, we're going to White Plains. So I pull up, and of course the big white tent.
When Captain Sosa arrived, he was suffering from the typical symptoms of COVID pneumonia.
You think you're invincible, but I saw the concern in the doctors' faces.
He had to go be intubated and transferred to our critical care area.
I started getting a little better. Then, all of a sudden, it was like a tsunami. I couldn't breathe anymore.
A number of the organs in the body can shut down. He ended up sustaining kidney injury. He had strokes.
I dropped him here on the 1st, and I dropped my mom off on the 5th. She passed away on the 9th.
I've been a nurse 10 years. This was the darkest time I've ever seen, and I hope I never see it again.
Captain Sosa, I would say, not only physically was going through a lot, but emotionally was going through a lot. It was very hard to be away from his family. We did a lot of FaceTimes with them daily.
There was a lot of anguish on the sides of the family, not being able to see their loved ones, having to make decisions that should never be made remotely.
He was in good hands. Absolutely. I felt that there was a lot of hope.
What we told our patients and Captain Sosa is, we're sorry that you can't see your family right now, but we were going to be family now.
But I didn't think it would be a long time before I would see him again,
These nurses sat with them and held their hands. They never left their sides.
Not only was she helping to take care of my husband, but she was taking care of me and my family at home, making sure that we were taking care of ourselves. The doctor who treated him in this step-down unit was an amazing, light force for me because of all the complications. He wasn't going to give me any false hope, but he was like the most positive person.
When we got him, he was pretty much bedbound on a ventilator, and a lot of our team was focusing on physical therapy, nutrition. Our main goal was trying to get them up and moving again.
They got me up. They were determined to give me to do that 1-step, 2-step.
Giving him that motivation to let him know, no, that's not your end goal. Your end goal is to get better, to get to rehab, to get back functioning like you were before COVID hit you.
He definitely was in a very tough place and was able to slowly and steadily, progressively come out of that.
Given how sick he was, how close to dying he was, and he suffered almost every complication of COVID you could have, that he was able to be discharged to Burke to begin the healing process and the rehabilitation phase, I think was just a huge step, just from a medical and physical standpoint.
The day he left, we were all so happy for him. A lot of the staff cried that day.
We played music for him. We had pom-poms in hand. We cheered for him. It was the most moving sense of love. I mean, these people, I don't know who they were, where they came from, but they were cheering for him.
We made sure that, he was strong enough and able to get to one of the best rehab facilities that was going to get him back home to his family, to his twin children, to his wife.
I knew it was life. She was my life. Now it's my turn to get better.
It was very emotional. One, because we were we were letting him leave our organization, right? And we had built a bond with him. But two, that handoff, when his family saw him, when his wife jumped on top of him, when his young kids saw him. And that's really why we do what we do, because at the end of the day, that's their dad, that's their husband, that's the guy who, you know, comes home every day and sits down and has dinner with them. And for 40 days, he wasn't there. So that's why we do what we do, because now he's able to do that. And that's something you can't replace.
Having good health care is the most important thing where you live, because you never know when you're gonna need them.
Overall, thank you for saving my life. They gave me a second chance. Yeah, and I'm gonna run with it.